Good afternoon, Professor. My name is Chigozie N. My EBP project topic is alcohol use among minority older adults. This topic was given to me by one of my preceptor who is a faculty member in the school, and I wasn't able to be posted in a clinical setting to actually carry out this project topic. Table of content. These are my table of contents according to the professor rubrics and the requirements. I'll be discussing the introductions, the significance, the statistics, the project topic, review of the literature, summary, recommended practice, policy and protocols for the change, implementation plan, evaluation plan, mission and references. The introduction. As the global population ages, the health and well-being of older adults become increasingly important public health concerns. One of the aspects that has garnered attention in recent years is alcohol use among minority older adults. The steady growth of minority populations worldwide, understanding and addressing the unique challenges this group face in relation to alcohol use is crucial to ensure their well-being, well overall health and quality of life. So it's important for us to address the challenges faced in this population that result for them to consume alcohol, which affects their quality of their life. Minority older adults in campuses in diverse array of racial, ethnical, and cultural background. This group often experience disparity in healthcare, access to resources, and social support, which can contribute to a differential pattern of alcohol use compared to their non-minority counterparts. Consequently, studying alcohol consumption within this demographic become imperative in tailoring effective intervention or support mechanism. So these people are coming from different backgrounds and they have a different definition of alcohol consumption. Some people look at it as a social norm or cultural norm. Some look at it as a part of a lifestyle. So there's a lot of factors that contribute to this. It can be cultural factors. It can be limited to healthcare access, and also even language barrier. So and also even disabilities and retirement. So it is important for us to look at the law intervention that will be effective in order to kind of reduce these concerns in the public. The significance of the problem. Due to health concern and possible health disparities, alcohol intake among older minority has to be researched. Based on their subjective and objective socio-economic circumstances, elderly economically disadvantaged African Americans may have particular drug use concern, Ashley et al. 2019. Because of the psychological change in older adults, alcohol misuse may result in hepatic, cardiovascular, and cognitive disease that are more serious. Yes, when you're looking at people at this age, when they get to this age, their both of their body system are shutting down. So taking much of alcohol can result in a lot of health issues, which can mostly the popular one most of us know are liver disease or cirrhosis. Sexual and age group minority women born of feminine may take drugs due to the internalizing sentiments and minority anxieties. Hooks et al. 2020. Older adults may face financial access barrier to healthcare, which impede the development of alcohol-related health problems. Some of them does not have money, some of them don't have an opportunity to kind of get to the healthcare. So it's a great barrier for them to take most of alcohol and without even being informed about alcohol-related risk, health problems. Drug usage is linked to stress expressed by sexual and gender minority, worsened by depth of medical care tailored to their cultural needs. Direct or 2020. It is crucial to research alcohol consumption pattern among minority older people to create advocacy program and therapy specifically tailored to their needs. To lessen injustice and enhance the health of the undeserved group, policymakers and healthcare professionals should address this problem. Statistics and data. I was able to pull out certain statistics from the National Institute of Alcohol and College 2020. Statistics show that 67% of 65 years and above older adults report high risk of drinking alcohol. Data from National Survey on Drug Use and Health indicate that approximately 20% of adults aged 60 to 64 and around 11% over age 65 report current binge drinking. National poll conducted showed that 10% reported drinking with their other drugs, 20% drank 4+ times, 23% had 3+ drinks, and 27% had 6 plus less one occasion among older adults. But EBP project question, the PICOT question being addressed by the evidence-based practice scheme is as follows. The population I'm looking at is minority older adults of 65 years and above who engage in alcohol use. What are the intervention I'm planning is cultural sensitivity, alcohol use prevention and intervention programs compared to the program for alcohol absentees and treatment. The outcome will be to lower alcohol consumption, enhance the health, and expand access to health. During this, throughout the project implementation and evaluation. The review of the literatures, critical fields such as alcohol use, substance use, minority older adults, cultural sensitivity interventions, and health disparities were used to look for alcohol usage among elderly minority adults. I was able to search on databases like PubMed, PsycInfo, Google Scholar for persistent information. Due to the particular pressures and the vulnerability, Fleet-Jean et al. 2020 emphasizes examining gender minority persons for hazardous alcohol intake. A global scoping study on drug use among gender minority women was done by Hughes 2020, highlighting the need for focused treatment. A review of ketamine cadmium efficiency in lowering local alcohol intake, craving, signs of withdrawal in alcohol use disorder by Crowley et al. 2022 urge additional investigations. Galino et al. 2023 investigated the connection between juvenile polyvitaminization, domestic violence, and drug use among college students. They advocated for prompt actions to lower problematic alcohol intake in later life. Summary of the evidence. There is a cross-sectional research, gender minority persons screened for hazardous alcohol intake. The dependent variable on this research is the dangerous alcohol usage on the Flantin et al. 2020. The result is age-related alcohol consumption in minority older persons must be addressed with cultural relevant treatment. Another research in the correlational research conducted by Galileo et al. In 2023, college students were tested for drug usage, intimate partner violence, and childhood polyvitaminization, which is the dependent variables. The results show that understanding other cultures improve the quality of healthcare professionals to deliver patient-centered care. Ketamine intervention for problematic alcohol use or alcohol use disorder, Carol et al. 2020. The dependent variable is alcohol intake, cravings, and withdrawal symptoms. Age-appropriate therapies and better health outcomes are made possible by routinely evaluating older persons for alcohol consumptions. Scoping review by Cooks et al. 2020 emphasizes the alcohol and other drug usage among Asian minority women, including cross-sectional and longitudinal studies. The dependent variables are alcohol and other drug rates, trends, and health effects. Patients who get information about the danger of alcohol usage are better equipped to make wise choices that will improve their health. Recommended best practice. The best method for lowering alcohol intake among other is to culturally relevant therapy. So this is like tailoring the care, the intervention based on the people culture by respecting them, their belief, their values, and also kind of making sure that the intervention we're planning to concrete on their care is mostly based on their culture, meaning that maybe we find people of the same color, people that speak the same language, and people who can be trained to understand the belief these people have because they are unique in different ways and the understanding of alcohol consumptions. Cultural sensitivity prompts involvement, trust, and improved intervention results. Yeah, if you can be able to imply this cultural sensitivity in our model of interventions, it will increase that trust, it will improve the intervention results, it will make them to accept the intervention very easily because they see that these people speak the same language, these people do the same understand this to have the same color of the skin, they'll be able to help them to accept such interventions, which will help them to improve their health care. Treatment must be tailored to each patient's requirements and preference to be effective. It has to be individualizing care. People are different. They are coming from different backgrounds. So it's better that every care intervention I'm suggesting has to be individualizing care. More efficient and polite care is provided when the culture of the people being assisted is acknowledged. If you can acknowledge their care, their culture, what we are conducting an intervention or discharging our intervention to them, it will go a long way to improve efficient outcomes because people show up, people understand, and people accept your intervention when they understand, when they know that you speak the same language with them, you believe in them, and you see them as a person, not as just a patient. Better adherence to treatment is encouraged by considering each individual as a unique. Regular monitoring old adult alcohol intake enable earlier issue diagnosis and immediate interventions. Yeah, Corona et al. 2020. In this particular regular monitoring, this is can be involved by doing screening and assessment. So we're kind of planning that if we're implementing a way that we can be doing a screen assessment, like kind of a routine checkup or screening in the communities, whereby we can be able to identify people who is at risk of alcohol consumption or who is already on the process of changing or who is taking the alcohol. So if you can be able to identify these people on this particular point, because the earlier you identify to the earlier we identify the people at the risk, it will be better for us to kind of offer timely intervention which will help them. So if we're able to identify them earlier, maybe during the screening, we can be able to do what we call brief intervention. We can be able to give them some intervention that will enable them to come out from such a habit. Or if eventually you find people who is severe, who has already gone, you know, who have already been on the alcohol consumption that have resulted in several health issues, we can refer them, we call them referral, we can refer them to behavioral healthcare system whereby the specialized provider will take care of them. You know, so that is necessary to for us to earlier detect them so that it can easily help us to discharge our duty early. So for older minority persons, earlier intervention may result in increased overall well-being. Like I said before, if you can identify it early, okay, it can help us to discharge our intervention very early so that they can be able to locate them easily and solve the problem before it become complicated. The policy and protocol for practice change. For older minority people, policy prioritize cultural appropriate alcohol treatment. Treatment for various cultural groups are tailored as part of the strategy. We need to understand the cultural people within the community we are going to or within the locality we are trying to help. We need to understand their culture because there's a people they may live in together but they have different cultures. So understand their different cultures and tailor our care based on each person culture will help be a big way to help out from these concerns. The significance of the regular alcohol consumptions assessments to identify problems quickly and take action, commitment to sponsoring research, program and initiative to improve well-being that are based on the evidence. Due to their complicated demand, older minority persons who use alcohol need extra services. Funding for translation, cultural competency training, and successful research program are necessary for cultural appropriate therapists. Adam et al. 2020. 2022. Healthcare professionals that are culturally aware may foster trust and provide patient-centered care. Yes, like I said before, if we can get people that we can train, people that can be trained on those community, minority people community, train them in the people's culture, people's way of behaviors, people's way of understanding when it comes to alcohol, consumption of alcohol, and these people understand it and discharge their duty accordingly. It will foster a trust. It will foster a trust, and also it will improve the health center, patient center care, and also enhance their well-being. If they understand that yes, this is people are with us. Then healthcare professionals, cultural sensitivity instruction improve communication and get rid of healthcare injustice. Yes, because we're looking at one of the factors that lead to people to consume people of this population to consume alcohol is language barrier. Some of them are not aware, some of them are not even informed about the effects and the risk of it. Some of them cannot even communicate to their health providers. So if you can be able to tailor our intervention on the language provisions like improving language, kind of understanding their language, it will help us to get rid of the healthcare injustice they experience. If most of them when they go to hospital to maybe kind of if they notice some concerns based on their body system, if they cannot speak English, it's really hard for them to actually communicate what they are talking about. So improve patient provider relation and healthcare outcome result from considering the preference of old minority patient with alcohol use demands. So implementation plan. Medical experts, academic, and community members are among the shareholders participating, establishing therapies and policies that are culturally responsive, integrating the actions is obtain money from the research and program of interventions, create training materials for cultural sensitivity healthcare workers, engaging neighborhood groups that get support from the locals, training for the healthcare service, instruction in communication and cultural sensitivity, sections regularly address changing requirements and demographic shifts. Activities in the community, lectures, outreach programs for patient educations, increase knowledge about alcohol and health, educate patients so they may decide for themselves whether or not to drink, the danger of alcohol on one's health, improve health outcome and accountability are included, which is the major results we are looking at when we implement this project. Evaluation, how do I evaluate? How do I find out whether my medication is working or not? And how do I monitor the progress? The enhancement in the healthcare indicator address alcohol use outcome indicators. Pre and post intervention questionnaires as well as medical record were used for data collection. Project research and medical personnel are the data gatherers. Updates and suggestions. The staff is updated on intervention progress and outcome during the regular meeting. Monitoring for unintended consequences. Regular assessment and tracking to spot official results. A prompt response is required to remedy any fault found during the assessment. Continuous advancement is keeping an open mind and looking for ways to do better. Ensure evidence-based, cultural acceptable treatment for other minority individuals. Very iterative evaluation. In conclusion, addressing alcohol use among minority older adults is an emerging public health concern that necessitates comprehensive research and awareness and actions. Throughout this presentation, the research project, we have explored the challenges of alcohol use among minority older adults and the impact it has on their health and well-being. We discussed cultural sensitivity interventions and the prevalence of alcohol consumption in the different minority groups. The cultural and social factor influence alcohol use and the disparity in the healthcare access faced by these populations. It is our responsibilities as a society to foster an inclusive approach to public health and ensure that minority older adults receive the support and resources they need to lead fulfilling and healthy life. Thank you so much. This is my references.